Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
So my name's Larry Bruhard. Got you. It's not. My name's Harry Tambuato. And I wanted to do that because Larry's not in the show. He's off in some other country. He'll be back very soon. Ladies and gentlemen, I have a story to tell you in this show. It's social responsibility, and I'd like, alam mo, the words, the issue of today is being truthful. Even Pinoy is being questioned. So is the student council presidency that we have. It's all about truth. It's all about branding. And talking about the truth, I'd like to share an experience. About 3-4 months ago, well, it happened actually 2 years ago, but the recurrence was worse 3-4 months ago. I suffered what I call a lower back pain. It got so bad, I was bedridden for over a week and a half. And then thereafter, I was in a wheelchair and then onto a cane. And I was able to get out of it. The funny part was I had to go to a number of doctors, medical doctors, and then hospitals. Nagpa-x-ray pa ako. Wala naman makitang bali, putol, disaligned, or whatever. Kasi lower back eh. But the suffering was unbearable. Then I met a trauma specialist. And I found out all the new techniques and a very different, how would you say it, outlook on how to improve oneself. That's why the topic for this first portion is called pain management. With us, we have Dr. Christian Mancao, who's a chronic pain specialist. Dr. Mancao, thank you for being on the show. You know, I had to share that experience to make it relevant as to why I find it imperative that you be on the show. Para naman the viewers, I can share it with them, the experience. Alam mo, when I went to see you, the pain was not only unbearable, as you well know, because you were the one who treated me, but talking with you, I found out from you that we need not live with pain. And then the funny part is, hindi pa alam naman, doctor, it's not a science when it comes to muscles and the rest of the body. As you explained, the body is 60% fat and muscle, and then the rest the organs. Maybe you'd like to carry on from there.
Yeah, the funny thing about chronic pain, because we're talking about the whole conundrum of chronic pain.
Do I know about it? Yes.
Is that the suffering that comes along with it. Suffering is defined as pain plus hopelessness.
Hopelessness.
Diba? Mabigat na yun eh. Yung pain, okay pa yun. Maybe you
Pero
can...
alam mo, gagaling ka. Okay, no?
It's the hopelessness, actually. After you have gone from doctor to doctor, they give you nearly the same medications, the same procedures.
But the medications don't work. It doesn't alleviate the pain.
Yeah, that's why it's called chronic pain.
Okay.
Acute pain, these medicines are okay. They work 80% of the time, more or less. But in chronic pain, that's a blank wall.
It's a blank wall.
And remember, you are not the only sufferer. The doctors are suffering from chronic pain.
The doctors how?
Even neurologists, they suffer from migraine, headaches, neck pain, shoulder pain.
So everybody lives with pain one way or the other.
Pain is the most common complaint of modern man. And that's the reason why they go to the doctor. That's the most common reason.
Correct.
Okay. Now, it being the most common reason, there should be more pain specialists who can easily address the problem. But the usual methodology is too long and time-consuming for a suffering patient.
Kailangan immediate eh.
It has to be, when you're in chronic pain, it's not a joke. Remember, there are two kinds of people, remember that. The sadists.
Yes, sadists.
Okay, the sadists cannot tolerate pain. That's why they keep on giving pain to other people.
Good point.
But the masochists, they love the pain. They're the ones who love the pain. So what I see in my clinic are the sadists. Okay,
okay, the sadists. Okay.
More or less, as a definition, it's the people who cannot tolerate pain. Others have very, very high threshold for pain. That's why even if you're cutting off the leg, they're still smiling. As a matter of fact, they might be enjoying it. Remember that.
Oh, my God. I have a high threshold, but I don't think I can handle being severely cut out. But go ahead, yeah.
So pain management is drug-based. Medical science has seen to it that it's drug-based, and in America they are pushing a lot of prohibited drugs, regulated drugs.
To numb the pain.
Temporarily, for a short period of time.
Pag nawala na, balik na naman.
It comes with a vengeance again.
Correct.
The problem is when it comes back with a vengeance, and you have to take the medications perpetually, more or less.
There's addiction na.
That is the bigger problem. That is why one of the more common causes of death in America is prescription drugs. And we all know that. You can see that in the TV, in the internet.
Here in the Philippines, Dr. Christian, it seems there are very few real pain management specialists. And yet we have what we call, because even TESDA keeps seeming to pump them out like in the hundreds. They're called physical therapists. The other word sa probinsya, manghihilo.
Manghihilo.
Yeah. Ano pa yung mga ibang words dyan? Yung everybody is a specialist. And they come with different herbs. And, I mean, close na lang. I mean, magvo-voodoo dance na lang sila, no? So there's many of these, and many people are being duped. I know because I was a victim of one of those. And and people pay good money for this. And it's sad, people don't know where to go when they're in pain. Why is it ganon? Don't the doctors see this demand? Don't they see the people suffering?
As I told you, that chronic pain management has always been a riddle in the medical side. It is...
Why? Walang academic study pa na enough research?
Okay, let's go over it one by one.
Okay.
Para maintindihan mo. The largest organ of the human body is not skin. Di ba? Skin is only 9 pounds in weight. And
you would think it is.
Yeah.
Huh? Yeah.
And muscle, because it's only 3 millimeters. The skin is only 3 millimeters thick. But muscle, by the way, they don't know how many muscles there are in the body.
Not yet discovered, ah.
They don't know.
It's 2013, hindi pa rin.
No, you open the internet, you just scratch your head because every scientist or person responsible for counting has a different number.
Okay. That's why you know nobody knows the real number.
Nobody knows. It's a blank wall.
Okay.
Nobody knows. And there's a specialist for every organ, true or false?
True, especially in the hospitals. Go ahead.
Yeah. What about, there is a pediatric surgeon.
Correct.
There's a surgeon specializing only on children.
On children, yeah.
There's an eye specialist that specializes only on the right eye or left eye.
Iba pa yung right, iba pa yung left.
Yeah, because it's...
Specialist.
yeah, for the equipment,
Okay.
ease of doing the surgery. But what about muscle? Who's the specialist for muscle?
That's exactly what happened to me, Dr. Christian. I went to the bone orthopedic, being the Philippine General Hospital for bone, whatever, thinking it was a bone, because it really felt like it was bone. Alam mo, they didn't know. They have no idea. Hanggang x-ray lang, that's it.
Now, if you went to the clinic, you see that my therapists are very small.
Yes.
They're small ninjas, okay?
They're very good. They're very, very good.
But when they see a patient, they can perceive already, they can see already where the pain is. That's why they exactly know where to do the procedure. And therapy is so simple. Come in, you go out, you go out smiling.
You walk, actually.
Yeah.
My first time, I couldn't believe that. It was like a miracle. But the reason I asked you talaga on TV, no, because I want to share with the viewers how many people suffer this and yet they don't know where to go, what to do. And you know, I realize there are people who learn how to live with pain all their lives. May ganun palang tao.
Yeah, they have a pain personality.
Oh, pain personality.
The problem with pain personality is when you remove the pain, they look for the pain.
Baliktad na.
Hindi sanay na sila sa pain. It's just like a husband who's a pain in the ass. And then he dies. When he dies, you
look for it. But he's a pain in the ass. But it's interesting that, and yet the solutions offered in the medical profession or in hospitals are all about the amounts of money you're willing to spend, but the solutions aren't even available. That's what's frustrating. Mahal na, ubus ka na, lahat na ng test, lahat pinainom na sa iyong gamot, pero you're still in pain. So, I don't understand. Why is it we don't have enough specialists here who will do this? Alam mo, the demand's very high. I didn't realize this until I started sharing my pain with other people, only to find out almost every other person I know is open to pain.
Yeah, but remember, the enigma of chronic pain, has been solved a long, long time ago. I've been doing that for 20 years. But remember, I don't use any medicine.
Oh, nga, that's
In just a few seconds, you're finished. You're smiling.
That's the interesting part. And yet, you're a medical doctor. Yeah. You work in the hospitals as well. But you try not to use pharmaceutical solutions.
Well, there was a nice medicine before, in the year 2004, when they stopped it.
Stopped it pa?
Yeah, Vioxx.
Vioxx.
Vioxx was a very good medicine for pain. It removed anger, frustration, all the negative feelings. Yeah, you're dead. It killed 100,000 Americans before they stopped the medicine.
No kidding,
Yeah.
Vioxx.
Vioxx.
Because it kills.
No more pain.
No more pain. But it's real, no? Pain is reality, which you see, because I've seen your clients that come to you and they're begging for help.
Yeah, that's
you know,
so.
it's not the amount of money. It's not. It's please
Relief.
help me.
Relief. They're looking
Relief,
for relief.
diba? And you see this, especially your therapist, before they even pounce on you, which scares the shit out of me when I'm sitting there. And yet I look for that therapy after. Baliktad din, nakakatawa. I'm the one looking for it now. But at first, you're perspiring, cold sweat. But when you stand up and walk away,
Sarap.
oo, no, it's ginhawa. The word is ginhawa. Bakit ko konti mga doktor hindi pinapasukan to?
Well, medical science has not yet written the chapter on that.
Wala pa. Even your therapy, you have this machine. I have been asking around. Just last week, my guest in my other show, Attorney Judd Roy, he had sciatica, which is what I had. But he went through a different treatment. It took him a longer time to get out of it. But you use this certain heat machine that you use on your body.
These are Australian ultrasounds, and they can push up to 3 watts. The algorithm or the formula actually for chronic pain is 2.2 watts. Right. But most of the hospitals and the rehab centers in the Philippines are used to treating 0.8 to 1.2 pulsed. It's cold. It's going to be cold. So since the ultrasound machine is a deep heating modality machine, deep heating, if you pulse it at 0.8 to 1.2, malamig, and the gel makes it colder in an air-conditioned room. So you're defeating the purpose of using a deep heating modality machine.
Bakit kailangan deep heating? Para it penetrates?
Well, remember, as sound penetrates the skin, it causes fine vibration. Just look at the cone of the speakers. They are vibrating. Okay?
That's right.
The vibration causes movement of stuck-up fluids, especially lactic acidosis, away from the area. So yung mga lamig, which is nothing but loculations of lactic acidosis, is moved out of that area and you feel the relief immediately.
And the lactic acid is the physical pain that you're sensing.
Anybody who is suffering from pain is acidotic. That's why their face is
ganyan,
asim.
But yet you're telling me almost every drug that you go to Mercury and buy almost any drug, everything is acidic.
Acid. It's an acid.
So the more drugs you take,
the more acidic.
Lumalala.
Yeah. That's true.
We don't know that.
Well, the doctors should know it because even paracetamol, which is supposed to be very, very safe, is the #1 cause of liver failure in America.
Paracetamol.
Yeah, but that's for American dosing, meaning to say 1 tablet, 500 milligram for 80 to 90 kilogram. Okay yung dose sa kanila. What about for the Filipina, which is just 1/3 or 1/4 or one half of the usual weight?
Overdose na kagad sa paracetamol.
Yeah.
And the more acid that you take in to try and address your pain,
The more
not
acidic you
realizing, the more lactic acid buildup, the more pain you're going to get.
Yeah, that's true. That's why, as I told you earlier, it comes back with a vengeance. After the pain starts to dissipate, and dito na naman.
How did you discover your solutions toward pain management? Because I've noticed you're not very pro-surgery. You're anti, in fact, incision and cutting you apart. And let's take the whole gamut of tests and get all the laboratory tests. You see, you're not very traditional like that as a doctor.
I turn to more natural healing. Being doing trauma surgery is not a joke. It's long, tedious hours of doing this. But after the trauma is the pain, post-trauma pain.
That's true.
They're
Now,
always
after the
there.
trauma is the pain. That's right.
Now, the problem is when we face the pain, we become drug pushers. And it's not a joke to be a drug pusher, always. Because you keep on,
Theoretically, yes.
you have to shift from this drug to that drug, and the patient starts to look for other doctors who will be giving the same drug but in a different market name. And,
Different brand na naman.
Problema na ang pasyente. So I thought of a method, since I know every nook and cranny of your body, to just reset you and make you more alkaline so that your pain disappears.
The words that you use, it's very simple. Lactic acid, alkaline, increase the alkaline base of your body, and immediately it improves. It sounds so simplistic, and yet no one does it.
Because that's the business.
That's the well, we know that healthcare in America has been their most serious problem because of the hospitals and the doctors overcharging.
Yeah.
I mean, really, the medical profession, for those who live in the States, it's abusive to the point, it's ridiculous. I hear of friends, $200,000, $300,000, $400,000 for whatever procedure, but the government takes it. Ang bigat. And here, baliktad, no? But then again, those who don't know and they go to the wrong doctors, pain management can be very costly. Correct me if I'm wrong.
Yeah, very, very costly.
Pag pumunta ka sa mga hospital, hindi nila alam ginagawa nila, correct? Tsaka hindi na-resolve.
The problem is, who's the specialist for your pain? Think of it. When you go to the hospital, who will you choose?
Oo nga, no? Sige. Hindi pwede surgeon, hindi ka pa naman, wala naman bali. Not yet.
The one who's going to see you will be a
First, a general practitioner. That's where you start.
Now, what does he do? He will now refer you to a specialist. Now, which specialist would be more appropriate for your problem?
Let's suppose lower back pain.
Okay. Low back pain. Sino kaya doon? Rheumatology? Maybe.
Maybe, yeah.
Ortho? Maybe.
Oo nga, no, ortho. Oo nga, no.
Neuro? Pwede.
Pwede rin.
Oo. Baka endocrinologist, baka kuanto, diabetic or whatever. Ang dami
Hanggang endocrinologist, pwede.
Kasama. Oo.
So, ang gagawin niya, iisa-isahin kayo lahat
Hindi,
yan.
but may problema ka. Because you're not 40 years old. You're more than 40.
Okay.
So they're going to say, kailangan ng cardiac clearance yan.
Okay.
Di ba?
So, 5 na. Okay. 5 na.
Pag cardiac clearance, matanda na, then maybe you have to look at what's in the eye. Baka makita yung perfusion mo or yung circulation mo. And yun,
Hanggang doon, meron pa rin.
Kasi
so, 6 na yan.
at your age, di ba, malabo na rin yung tingin.
Oo nga, no? That's right.
Once you hit 40, di ba, life begins to deteriorate at 40. They just forgot to deteriorate. They just say life begins at 40, but that's where midlife crisis comes in.
The real crisis meaning the deterioration anyway.
Yeah, because that's where females' hormones goes down.
That's right.
Estrogen, progesterone goes down. The male testosterone starts going down. At 40, that's why they start to look for young grass to stimulate them. But these are all manifestations of stem cell failure.
It is stem cell failure, no?
Kasi stem cell is the repair, maintenance cell of your body, but natutulog lang sila at 40.
Kasi it doesn't regenerate itself. The body does not regenerate. It starts to shut down slowly, is what you're saying,
because
at 40 years old.
The repairmen are beginning to sleep already.
Napapagod na.
No, they're not pagod. They just sleep.
They just sleep.
Kasi the hormones are going down, and there is no strong stimulus for them to go to work. So they go down, down, down. At 40, that's where diabetes, all the degenerative diabetes, everything, osteoarthritis, hypertension, that's when...
So, if I went to the doctor, you'd easily be passed through from one specialist to another. If your pocketbook doesn't run low, if not run out, the pain will stay with you. It will just keep getting worse, especially if they start medicating you with all kinds of acids. Correct me if I'm wrong.
Yeah, that's true.
At the end of the day, after maybe 2-3 months of pain, because you're not addressing your pain, nagsusustain. Pag nagsusustain, you're getting used to it, you're becoming a difficult person because you're in pain all the time.
But you forget the side effects of the drugs.
Which is?
Gastritis, peptic ulceration,
perforation,
penetration into the head of the pancreas. That's just one of them. But chronic use of non-steroidal anti-inflammatory drugs, which is the choice for pain, causes kidney problems. It diminishes blood flow to your kidney. So if you're diabetic,
That's right.
then you end up with a dialysis, and dialysis is quite expensive. That is why...
Yeah, you don't live in dialysis, not for anything. I'm sorry, but eventually you go, but yes.
That's why I opt to do it the more natural way. Natural healing is a better approach.
But isn't natural healing against the theory of the medical profession? Western medical profession, not Eastern.
It's funny because Hippocrates, he admonished the physicians of his time to be proficient in the art of anatripsis. Anatripsis is nothing but manipulation. But that is a long-lost art. We doctors now are more ball pen pushers, and of course we have our stethoscope. We cannot make a diagnosis right away if we don't do a battery of examinations.
Yeah, I noticed that.
For legal purposes, we have to do that also.
So may politics din kayo?
The problem is the patient. We want the patient to improve dramatically. That's what we want.
Because you want to help him.
Yeah.
You want to take out immediately. Okay, ladies and gentlemen, we're going to have to take a short break. The purpose of the show is to share with you the misery that you may be still suffering from. Helping to understand the issues may help you better, will help you with your body to ease that pain. There are solutions. The pain management solutions of Dr. Christian Mancao in his office is one of these places that actually address this. When we come back from the break, we're going to talk about the other specialty, which we seem to always read about but know very little about, except for the fact na ang mahal niyan, para sa mayaman lang yan. But wait, hang on. It's not necessarily true. There are other ways, and there are other procedures, and they're all under the title stem cells. Stay with us, and Dr. Christian Mancao will explain this to you.